Welcome to the Pediatric Review, where I help you prepare for your pediatric nursing exams. If you would like a copy of the study guide, you can find it on my website. Let's talk about pediatric renal and urinary disorders. So the first disorder we're going to talk about is glomerulonephritis. So this is a kidney disorder characterized by inflammatory injury to the glomerulus caused by immunologic reduction or autoimmune disease. This can lead to kidney failure, hypertension, encephalopathy, pulmonary edema, or heart failure. Signs and symptoms. These are important to know. So, periorbital or facial edema that is more prominent in the morning. So that again is a very specific sign. Anorexia, decreased urine output, cloudy, smoky, brown-colored urine. This is another key sign. Pallor, irritability, lethargy. Older children may have abdominal pain, flank pain, or headaches, hypertension, proteinuria, or foam in the urine. So again, another key sign. Our nursing interventions are going to be to assess for the airway, patency, vital signs, and weight, assess for bounding, increased pulse or distended hand and neck veins, assess for elevated central venous pressure and dysrhythmias, limit activity, administer diuretics, initiate seizure precautions, and remember that they are at risk for fluid volume overload and usually have peripheral or periorbital edema in the acute. Now let's talk about nephrotic syndrome. So this is a kidney disorder characterized by proteinuria, hypoalbuminemia, and edema. Signs and symptoms are weight gain, leg or ankle edema and ascites, periorbital or facial edema that is more prominent in the morning, low urine output, urine is dark and frothy, blood pressure normal or slightly decreased, lethargy, anorexia, or pallor. And our nursing interventions are to monitor vital signs, weights, intakes, and outputs, monitor urine-specific gravity and protein, monitor for edema, and corticosteroid therapy or immunosuppressant therapy, diuretics, and plasma expanders. Then we have hemolytic uremic syndrome. This is a bacterial toxin, chemical, or virus that causes an acute kidney injury in children 6 months to 5 years. Signs and symptoms are hemolytic anemia, the triad of anemia, thrombocytopenia, and kidney injury, proteinuria, hematuria, urinary casks, elevated BUN, nitrogen, serum creatinine, and decreased hematocrit and hemoglobin. And our nursing interventions are dialysis, fluid balance, and adequate nutrition. Then we have enuresis. So this is the patient is unable to control their bladder function even though they have reached an age that they should, which is usually 5. Nursing interventions are urinalysis and culture, make sure they don't have an infection going on, limit fluid intake at night, initiate a reward system, and have children involved in the cleanup. Then we have Cryptorchidism, which is a condition in which one or both testes fail to descend into the sacral sac. Nursing interventions after the age of 1, medical or surgical treatment may be initiated, and older children may be prescribed HCG. So this is HCG. This is supposed to be human. So HCG stimulates testosterone. Then we have epispadias and Hypospadias. So these are congenital defects involving abnormal placement of the urethra within the male genitalia. There are different types. So the first one, epispadias, is the dorsal urethra opening, and Hypospadias is the ventral urethra opening, which can lead to bacteria entering into the urine. Surgery is usually done before the age of toilet training, which is 16 to 18 months. Circumcision may not be performed due to keeping the skin for surgical reconstruction. Nursing interventions post-op is they may have a pressure dressing. We want to monitor vital signs, encourage fluids, and monitor INOs, provide pain meds and anticholinergics for bladder spasms, and administer antibiotics. Then we have bladder exstrophy, which is a congenital abnormality characterized by extrusion of the urinary bladder to the outside of the body. Nursing interventions are to monitor output and the signs of infection or renal function, maintain integrity of the exposed bladder, prevent bladder tissue from drying while allowing for drainage of the urine. So we want to cover the exposed bladder with a sterile dressing, administer antibiotics. And applying petroleum jelly to the bladder mucosa is avoided because it tends to dry out, adhere to the bladder mucosa, and damage the delicate tissue when the dressing is removed. We do not do that. If you would like a copy of the study guide, you can find it on my website, blossomwithjessica.com.